Okay, in order to splint a patient's arm, you may need to do this if the patient maybe has a fracture and we're waiting for them to have a cast put on. Sometimes they're swelling and whatnot. So a splint, a plaster splint, is always a good idea to do in the office periodically. So in this particular case, our patient here, Rose, we're going to pretend she has a Colles fracture, so she's fractured her wrist. So what I'm going to do is have you just relax your arm kind of right there. And what I'm going to do first, Rose, is I'm going to go ahead and measure how long my splint should be. Okay, is your arm okay like that? Yes. Comfortable and doesn't hurt? Mm-hmm. So I'm going to take my tape measure and I'm going to measure right under the pads of her fingers. Okay, so this is where I'm going to start the measurement. I want to make sure her wrist is cocked up at a 45-degree angle, and I'm going to measure all the way until about an inch before her elbow. Okay, so make sure your patient's wrist is cocked when you measure, because the distance will be different if it's cocked versus straight. And then about an inch before the elbow, so right about there. All right, Kim, you can go ahead and relax your arm. And so now I know about how long my pieces need to be, and I'm going to cut 3 pieces of this cotton batting and 3 pieces of the plaster splinting, the plaster splint material, the length that I just measured on my patient. So I have 1. And then I'm going to lay the second one directly on top, nice and flat, because I don't want it to be bunched up for when it touches my patient's skin, because what that can do is cause circulation problems then. And they don't need to be perfect, just kind of right on top of each other. And then what I'm going to do next is I'm going to do 3 pieces of the plaster material as well, the same length. So 3 layers of each. All right, so the next thing I want to do is go ahead and apply my gloves. The reason I do this is so that I don't get plaster all over my hands. And I'm going to pick up the 3 layers of plaster all together as one piece, and I'm going to dip it into the water to activate the plaster. Okay, so I got all 3 pieces here nice and neat together. So just the plaster, and I'm going to dip it into the water so it gets nice and wet. The water should be warm, not hot, and not cold. If it's cold, it's going to be really cold on the patient's skin, and if it's hot, it could burn the patient. Now what I want to do is get as much liquid out as possible. The more liquid I get out, the faster my plaster splint is going to set up. So now the difficult part sometimes can be is unfolding it. Once you mush it all up, I'm going to lay it on top of my cotton, and I'm going to spread it all out so that all of these little holes are filled or mostly filled, and that's going to give my plaster splint more stability. It'll make it more rigid. So I want to fill in those holes. Okay, so once they're mostly filled in, what I'm going to do now is I'm going to pick it up and I'm going to flip it over so that the cotton side is touching the patient. All right, Kim, we're going to go ahead and put that splint on now. I'm going to go ahead and put it right up underneath from where I measured, making sure I have it even on both sides. And I'm going to hold it on my patient. It's going to take about 5 minutes or so. Okay, you can relax your fingers and relax your shoulder just right into my hands. Perfect. So that what's going to happen is as this gets hard, it's going to supply support for my patient's arm. So if she has a fracture there, we don't want that fracture to become displaced while we're waiting for the swelling to go down. Before she's casted. So what this is going to do is going to help with stability for the patient's bone. It's also going to help the patient feel better as well. We'll probably put her in a sling after this or something of that nature. During this time, what I could do is chat with my patient. It's going to take about 5-6 minutes for this to kind of start to hold its form. Now you don't have to wait until it's totally rigid or hard to start putting to do the next step, doing the roller gauze, just so that it's holding its form a little bit, but it does take about 5 minutes for that process to happen. So if I wait about 5 minutes or so, what I might want to do at that point is maybe call a fellow medical assistant in to help me out, a fellow coworker, So I'm gonna have you hold that back part. Once it starts holding its form, like I said a little bit, then we're gonna take our roller gauze and I am gonna start at my patient's fingertips to secure the top half. I'm gonna go above the thumb twice. And now after I've gone around the thumb 2 times, I'm gonna go start underneath the thumb going around the wrist. Now you want this to be snug so it holds the splint in place, but not so tight that it cuts off the circulation. How's it feeling, okay?
Feel fine.
Okay, it's not too tight?
No, that's good.
As I make these passes, I want to make them about half the width of the roller gauze. So you see how when I overlap, when I come around, I'm going about half the width as I was earlier. So it overlaps at about half. Thank you, ma'am. Okay, all right, you can relax down. Now what I'm going to do is get a little tape so I can secure the end. 1 or 2 pieces, depending upon where it ends. All right, now I want you to make sure you keep your wrists up like that, because that's what's going to be most comfortable. Is that feeling okay?
Yes, feels
all right,
fine.
Can you wiggle your fingers without too much pain? All right, your fingers feel okay. So I want to check the circulation to make sure I haven't cut off the patient's circulation in any way, shape, or form. All right, so I'm gonna have you rest that right there. That is gonna go ahead and harden up even more for you, okay? The last thing that I wanna go over with you are a few care tips for that splint, okay? Now, what I have here, it lets you know when you can take your splint off, when your appointment with the specialist is, and any follow-up that you need to do here at our office, okay? Do you have any questions?
No, none at the moment.
Okay, this is for you to take home with you. And like I said, if anything comes up or you have any questions, please give our office a call. The telephone number is there at the bottom.
Oh,
Okay? All right, thank you.